I'm Joseph Robert Garza, and I'm the Medical Director of the Advanced Fertility Center of the Institute for Women's Health. In general, fertility preservation is a new advancement in what's called assisted reproductive technology. And it is new developments in the in vitro fertilization embryology laboratory that allows us to freeze eggs successfully, then later on unfreeze them, fertilize them, and then return them to the patient. Our embryologists in the laboratory that we have been able to freeze the eggs, vitrify them, unfreeze them after about 5 years, and we've had successful pregnancies through our laboratory, and pregnancies to term, and children that have been born successfully. Right now, the first candidate that comes to mind is always a patient that's been diagnosed with cancer, and what they're looking at is chemotherapy, radiation, or even the removal of their ovaries to survive the cancer. These patients are a candidate to retrieve their eggs, vitrify them, and freeze them, and then after, it's usually about 5 years, once their oncologist has certified that they're cancer-free, we can go back, unfreeze the eggs, fertilize them, and transfer them back to the patient, and hopefully in over 90–92% of cases have a successful pregnancy and delivery. The second type of candidate for egg preservation or fertility preservation are patients who, for career reasons or age reasons, want to preserve their eggs, keep the option open to achieve a family, and not run the risk of advancing in age and getting close to the point where Down syndrome or other birth defects become more common. A third reason are those patients who need to consider in vitro fertilization, but for legal, ethical, or religious reasons do not want to have spare embryos frozen because they don't want to face that dilemma. We can freeze their eggs, fertilize only the number they feel comfortable transferring, and if they don't get pregnant or later on want to have a second pregnancy, then we can go back, unfreeze those eggs, and hopefully achieve a second pregnancy. Certainly any couple or patient that's interested in discussing fertility preservation, we welcome them calling the Institute and arranging for an appointment, and we can go over their options and if they're candidates and what they need to consider in making their decision. They can also go through their OB-GYN or family practitioner, and they'll refer them here for a consult. Our website is www.advancedfertilitycenter.org, or call the Advanced Fertility Center, and our phone is 210-616-0680.